Hi, I'm Dr. Mark Fraiman, the Chief of Hepatobiliary and Pancreatic Surgery at St. Joseph Medical Center here in Towson, Maryland. Today's medical tutorial is a review of liver anatomy and how it applies to liver surgery. The liver is one of the largest organs in the body. Has a shape that's somewhat oblong and is divided into a right and a left lobe. Further subdivisions of each lobe are divided into segments, with the right lobe having 4 segments, the left lobe having 4 segments. So let's go ahead and draw this. This is the left lateral segment, which comprises of segments 2 and 3. Segment 1 is the caudate lobe, which wraps itself around the inferior vena cava, and that's segment 1, the majority of which belongs to the left side, and a small portion of which belongs to the right side. Segment 4 is divided into 4A and 4B, which is part of the left lobe. The falciform ligament actually divides the left lateral segment from segment 4. The right lobe is divided into roughly 4 equal segments, which comprise 5, 6, 7, and 8, with the gallbladder typically in this area here. Now the gallbladder position can vary. There are some patients that it may be closer to 4 or 5, sometimes it's just 5, so there can be some variance with the position of the gallbladder. Actually, it's typically, I'm going to move it over. It's typically really 4 or 5. The inferior vena cava runs retrohepatically. Cantley's line is roughly the division of the right and left lobe, and it runs somewhere from the middle of the gallbladder fossa to the inferior vena cava. So this is what we call Cantley's line. And the drainage of the liver is through the right, the middle, and the left vein. Typically the left and the middle have a common trunk entering the suprahepatic cava. The right is usually a single branch, like here. Now we're going to talk about, this is typically called the outflow of the liver. I'm going to talk about and describe the inflow of the liver. But I do want to clear so we'll go ahead and draw the liver again. segments 2, 3, segment 4, 5, 6, 7, and 8. So each individual segment has its own blood supply, which is hepatic artery branch, portal vein branch, and a biliary radical or bile duct branch. And usually they're surrounded in some type of sheath, a Glisson's sheath. So it's actually easy to determine using ultrasound which is the outflow or hepatic venous side versus the inflow side, because there's more echogenicity from this Glisson's sheath. So every one of these segments is supplied with branches, individual branches, so it's almost its own individual piece of liver. The inflow occurs at the porta hepatis, or what we call the hilum of the liver. And within this bundle, you get, like I said, a portal vein, hepatic artery, and so forth. As it enters the liver is where it is surrounded by Glisson's sheath. Because of this very elegant anatomical structure of the liver, liver surgery is relatively anatomic. In other words, surgeons have the option of performing a right hepatic lobectomy, which is removal of segment 5, 6, 7, and 8. Individual segments on the right lobe can be removed, 5, 6, 7, or 8. The posterior segments individually are a little bit more difficult. Segment 8 is more difficult to remove in isolation than segment 7, for example, just because of its location, but nonetheless it can be done. A left hepatectomy would include segments 2, 3, 4. A left lateral segmentectomy actually includes segments 2 and 3. Segment 2 or 3 can be resected individually. A right trisegmentectomy is the largest resection, which usually comprises 70 to 75% of the liver. As long as you have a healthy remnant, which includes 25%, the liver will sustain life until the liver has had enough time to regenerate, which takes a good 4 to 6 weeks. A trisegmentectomy is a resection of segment 4, 5, 6, 7, and 8, with or without the caudate lobe, leaving a segment 2 and segment 3 intact. That's a right trisegmentectomy, which is the more common procedure. A left trisegmentectomy, however, is possible for large tumors that are encompassing the more left-sided structures, and that would include 2, 3, 4, 5, and 8, plus or minus the caudate lobe. This concludes my quick review of the liver anatomy. For more information, please visit my website at www.liverandpancreascancer.com. I thank you for listening.